Hey everyone, it's Dr. Svehlak. I want to talk about a real, almost simple procedure that I do sometimes right here in the office. A lot of patients that'll come in and be worried about having a small chin, retruded chin, and most of the time what people will do or have done is get fillers injected. So you put some filler in there to reshape the chin and build the chin up, and it works well. It's just something that has to be maintained regularly because most of the fillers will go away. Another option that's more permanent is doing a chin implant. Chin implant, most of the time I do them right here in the office. It's usually about an hour or less long. Implants come out of the packaging completely sterile. Here's a typical implant right here that I use. Here's another slightly different design, but there's many different designs. There's many different sizes. From very small to extra large, and I'll do some measurements and determine what I think would be best to start balancing your face out. So the implant, then once we got it out, we soak it in some betadine, and then we just slide it into that little incision inside the mouth. Slide the other end along the other side. Make sure I can palpate it's in the right place. Make sure the center line is where it's supposed to be. And that's it. And then there's a couple stitches that close that lining over the implant on the inside of the mouth. It's done. The whole process, like I said, is about an hour, maybe a little less. There's no scars on the outside of the face. You can see a difference almost immediately, other than some swelling. And over the next several days, as you're healing, there's going to be a little swelling. Most people don't get bruising, but occasionally that happens. And usually within a week, it looks pretty normal. And then after several weeks, it will start feeling more normal. Here's an example of someone I just did, a young man who was really concerned about his chin, a retruded chin. It was small, based on the proportions of his face. And a simple thing was to slide that implant in. I used a large implant that goes out to the pre-jaw area. The whole process was less than an hour, and he's super happy about his results. And they're probably going to even improve more because these are only about a month out. So usually when you get about 2 to 3 months is when you see the maximum effect, because then most of the swelling is completely gone. So if you're concerned about a chin, you're worried it's a little small or you want more definition along your jawline, a chin implant could be a good option for you.